Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning. Good morning.
Good morning again.
Okay,
How are
and
you
we
doing,
are now
Ina?
on doing
Fine.
Dobre
Facebook
utra.
Live.
Dobre utra.
Inushka
Buenos dias.
papanushka.
I'm working on this. I'm working on this.
We're working on the
Yeah.
live video.
Yeah,
live
we're
video.
doing that right.
We're
We're
going
starting
live.
it right now.
We're going live.
Right, I got to keep my hands straight. I got it now. You're
Now you
great.
can see us live.
Oh, you're beautiful.
You're gonna be able to smell us too.
You're so bad. You are so beautiful. If you move so fast now, you're going to have to write.
Jimmy John.
Get the
Right.
waggling ponytail.
Okay, and
Flappy.
now I'm
Flappy.
going to move over here to our beautiful Ina.
Good morning.
Good morning. There she is. Okay, now we're going to move back. This is the weirdest thing. Okay, here we are. Now,
And then a lot of you don't get to see the beautiful Anita.
no. You're so nice. You're so sweet. You were telling, now I've got it all mixed up. Now I got to switch it. What did we do? I have to switch. What happened here? Finish.
Okay.
Oh, I don't know how to get it back the other way. Okay, let's see. Wait, live. I
Yeah.
think
Reach
I
out
did
to
it.
the
I did
rescue.
it.
You
No,
gotta
no,
get it
I didn't
back.
do it. He doesn't know. Okay, well, let's just keep
So,
talking because we have to
right,
do that,
so-
and I'll figure this out. I'm just going to get rid of it, and I'm going to come back. Okay.
So
Just talk about when
How
we left.
about we
Yeah.
come back to the story that we finished
Yeah,
with?
that's what we need to do.
So we were talking about this engineer who is my patient for several years now. And it was interesting to see. One day he said, Dr. Mencia, I need to talk to you in private. And I say, okay. And I brought him, we got all the students out of the room and everything. And he was telling me, I was seeing a psychiatrist, and I never told you I take medication. I take psych med. And the psychiatrist now, he retired, and it's so hard to find a psychiatrist that won't see you if it's no cash. A lot of
Really?
a lot of psychiatrists now, they will charge you cash, and then you can submit your bill to your particular insurance, especially like Medicare, which means the elderly. So I told him, I said, I was a psychologist before I became an MD. And so we went over the medication, and I say, I can prescribe that to you. He said, I didn't know that. Because he said, my previous primary care doctor, he said he will not prescribe weight loss medication. He will not prescribe psychiatric medication. He will not prescribe painkiller. I said, what does he or she prescribe to you? He said, she used to prescribe my diabetes and my stomach medication. I said, no, I'm a doctor. And not only because of my background in psychology, I manage the entire patient, So we have patients that are on a weight loss program at the center, and they don't pay any extra. It's basically what the insurance pay is a regular office visit, and what the insurance pay we collect. And I think it's our duty as physicians, as we are responsible to control hypertension, control diabetes. Also, we are responsible for controlling obesity, pain management, and psychiatric condition. And we should know when it's time for us to say, it's out of my league, I need a specialist to come in, and we do have that. So to use, for example, my patient with diabetes, those patients that have diabetes, we have an endocrinologist. Those patients that have thyroid disease, we have a endocrinologist that can treat the condition. But the initial workup, initiating treatment, all of that, we feel very comfortable as primary care doctor, and being a geriatrician, starting those medication, and then get the consultant to see what else we can do to make sure we get things under control. And
then,
he was so happy to say, "Oh my God, so you mean I don't have to keep looking for another psychiatrist? You can take care of my problem?" I said, "Of course, that's why I'm your primary care doctor."
And what I want to add to this is the fact that you have a nutritionist so that some people don't have to take medication. You can do it through food.
Correctly.
Oh, we have so many people now watching you.
I have
someone in Australia.
we have so many people that see one of the three dietitians. We don't have one. We have three dietitians that works and see patients at the office, and they work 6 days a week like we do. So the dietitian can be seen on a Saturday. Saturday is your best day, or during the working days, Monday through Friday. So we have three dietitians that work, and I believe in dietitians so much because I think that's one of the things that help us minimize the use of overuse of drugs. For everything, there's a drug. I have one patient that went to the cardiologist, and just being at the cardiologist came out with 3 drugs, and she goes like, "I don't want to take drugs for my cholesterol." And I said, "Well, your cholesterol wasn't that bad." But she said, "Well, when I told the doctor that my family has heart disease, I said, okay, but you have a different lifestyle. You are first of all, you are a personal trainer, so you are always training. Second of all, she comes from an Italian background. Your family will eat a lot of food that you don't eat. And third of all, you are always getting yourself checked. That, back in the day, people would not go to the doctor unless they got sick. And in my practice, I have a few patients that come once a year. They will not come and see me unless they are sick. They have that philosophy. But I have a lot of patients that say, Dr. Mencia, whatever it takes to practice preventive medicine, I want to be here with you. And they come once a month. They come for a quick visit. We check on their blood pressure. We make sure every 3 months we check on the lab, see how the cholesterol is doing. And when they see the dietitian, sometimes the dietitian will go ahead and work with the patient, decreasing the looking at the same blood test. And that's one of the beauty at AGI, is that we are able to work, all of us, on the same ultrasound that had been done, on the same lab that had been done. Our notes, I can be at home and open my chart and look at my patient's notes and look at what the endocrinologists have to say. If I have any concern or if the patient is calling in the middle of the night, I can look at all the consultants, and all of us can do that because our chart is in the cloud. So we can open the chart from anywhere. Not only that, when you come to AGI, you can register your email and you can have access to your chart. So the patient that live here, if they go to Australia, where we have one of the listeners there, if they go to Australia and they get sick and they need to see a doctor, they can just open their chart and have the doctor look at what the last blood test was and what was the medication and allergies and what have you. And sometimes you will remember certain medication that you are allergic to, but you will not remember others. And was it a severe allergy? Was it a mild allergy? And that become important. So, life have evolved that we don't use paper. Everything is, is in the chart, and you can have access to that. I have one of my patients, she's a doctor, she's an anthropologist, and she's retired. And her son lived in South Africa. And he had his family there in South Africa. And they came to visit. I've been taking care of her for probably eight years. And he came to visit, and he said, Dr. Mencia, last time Mom came to South Africa, she got really sick. And, of course, we took her to the doctor, and she has severe diabetes. She see me, she see Dr. Ramahan for diabetes. So He said, we couldn't connect, so the time different and all of that. I said, well, you know something, you can put your name on the chart if your mom is okay with that. And you can have access to mom chart from South Africa. And that way you can see when we do blood tests on her, you can follow. They were so happy. They were so happy to hear that.
Wonderful.
Yeah. So, you can designate, and it have to come from the patient. They can designate a person that they want, that they trust, and they want to follow up with a blood test or anything. And then usually the way I work, I don't call the patient to let them know how the lab is. I don't do that. It's a teaching moment for me. So what I do is I will have the patient come in person and sit down with me. And then we take the lab, and I give them a copy if they want. Or if they are registered, they can review it before they come in. So we look at the lab, and we go step item by item and say, because sometimes they'll do, especially if you go to a doctor, that they don't do preventive medicine. So they don't take and break down your cholesterol. They give you the total cholesterol, which is a big mistake, because your total cholesterol in one person, it could be, let's say, 220. So anything over 200 is supposed to be bad. So the computer automatically is going to flag you and say your cholesterol is 220, it's too high. When you break that cholesterol down in two different patients, on this patient, 220, the good cholesterol is 110, and the bad cholesterol is 60. And then you go through the triglyceride, that would be a good 220. On the other person, the good cholesterol is 20, and the bad cholesterol is 180. And the triglyceride, you add that up, and then that will make up the 220. This is a bad thing to have, because what that means is your bad cholesterol is the one that can produce damage in your body. The good cholesterol is the one that protects you. So when I review the blood test, and I tell my patient, well, your bad cholesterol is good, is, let's say, 60, 70, but your good cholesterol is no good. It's too low. And he said, okay, so do I have to take a pill for that? I said, no, you have to see the dietitian, and you're going to start using fish oil to increase your good cholesterol, eating salmon, black olives, and then we go through a diet or all of the things that are rich in omega-3 and omega-9. And it just happened to us last week. We had a patient that came in, and she said, oh, I listened to you and Anita talking about the cholesterol, so I brought you my omega-3. So I want you to look at it. And she had two different brands that she was taking. It so happened the students were there, and I got so excited. I called all my medical assistant, all my staff. I called everybody into the room. The room was packed with staff and the patient. And she goes, what? Is it that good? Is it that good? I said, no, it's that bad. Because I say, I'm always telling in front of the staff to the patient about the good cholesterol and to be careful with the fish oil. So this lady had two different brands of fish oil that say omega-3 1,000 milligram, and the other one say omega-3, I think it was 900 milligram. And when we look at the back, we turn the bottle, and then we look for the good fish oil, and that is omega-3 and omega-9. So omega-3 was, I think it was like 70 on one or 45, and omega-9 was like 50. So it's less than 200. So we look at the other bottle on the other brand, and it was very similar. And I say, what this means is that the tail omega, because you only have three omega-3, omega-9, and omega-6. Now, omega-6, you are going to find that in ice cream, French fry, hamburger, the bad cholesterol. That's the bad omega. That's the bad one. And the FDA require that if we produce fish oil to sell it to the public, we have to let them know 2 out of the 3. So once you know 2 of them, the third one you can determine what it is. You can calculate it yourself. That's what the FDA, that's what the government require. To tell 2. I have only seen one brand that say how much omega-6 they are giving you. And I don't know if it's because they've been sued or something, and they decided to put it out there, so people don't come after us anymore.
So they hide it, is what you're saying.
Right. They only tell you about the 2 good ones, and they don't say anything. You have to calculate how much of the bad one. So if you're at home, look at your fish oil if you have it, and then you look at your omega-3 and omega-9, and you add those 2. And when you add those 2, the brand that we have in the office is like 600 of omega-3 and 200 of omega-9. That means out of 1,000, you are getting over 800 plus of the good fish oil. So that's a good brand. So you have to add them up, add the 3 and the 9, and see how close you come into that 1,000. And then the rest, if it's a small amount of the bad cholesterol, you're going to be okay. But in this case in particular, the lady was getting such a little amount, and it was expensive brand. So the price of the brand have nothing to do with what you are getting.
Okay, so I get vitamin D from you. How come you've never asked me to get the omega? I need to do that.
Well, we have to look. Remember, it's according to the lab. I don't like to push supplement if you don't need it.
Oh.
We have, like I tell my patient, we have supplements here just for convenience. You can buy it from anywhere you want to. Go on the internet, get it. But make sure you are getting, if you get this brand, because my dietitian, they had done the research on the different type of fish oil available. And then we decided to choose the one that we thought was, number one, was not pricey, and number 2 was providing us with good brand of omega-3 and 9. And that's why we have it there for convenience. But I tell my patients, I say, just look at the brand if you want to and buy it elsewhere if you can.
Something you said, though, that is so important is the fact that you don't tell people over the phone, well, these are the measurements, this is what we found. Come into the office and let me explain.
Of course.
Doctors don't do that.
Of course, because,
excuse me, they have an assistant call you.
An assistant
calls
you.
and says, well, your report was this or your report was that. That's
what does
terrible.
it mean to you? What does that mean?
I know that.
It doesn't, you can have, I wrote a book on protect your kidney so the kidney can protect you. And you can have small amount of renal insufficiency and you won't even notice. You cannot wait until you are close to dialysis to worry about your kidneys. Too late. And once you get to that stage, we're going to talk about renal transplant. We're going to talk about things that can be prevented. A lot of the renal damage that we see there, over 80% of the renal damage that we see out there is preventable, and that's what encouraged me to write the book, protecting the kidneys. Now, my book don't have the popularity of the drugs out there, because if you look at the drugs that are used, the dialysis center is millions and billions of dollars. So, we put more money into getting more drug out there to treat the people with kidney disease, into putting money in prevention, and teaching other doctors. And I spend a lot of my time lecturing and teaching other doctors and nurses on the kind of thing we can do to protect the kidney, to prevent, damaging our kidneys.
Dr. Mencia, I have to tell you, the calls have just been, the people here, there's a gentleman, I don't think I'm going to tell people their names, but he says, how do I buy a case of vitamins and fish oil for my whole family from you, Dr. Mencia? And then, so we had that. Then we had, there's so many. So
they can call the office if they live locally. It's 954-489-1345. What's the number for the Boynton office?
Boynton office is 561-270-6494.
They can go on the website also,
They can buy it on the website, yes.
and that is
AGI. Well.
www.agifl.com.
Right,
Excellent.
AGI.
So that way you can obtain it, and also my skin product. You can also buy through the website. I have also started a line for the skin that I use myself.
I was going to say, every time you come in, you have this beautiful, glowing skin.
Thank
I
you.
mean, it is. I mean, it's so gorgeous.
Thank you very much.
Yeah, is that what you're using?
I use the product that we have. I've been doing aesthetic for so many years or so, and we are a complete office. We are
Yeah,
a
I know
complete
you
center.
are.
We've been doing aesthetic, and I do aesthetic because being in the martial art, being a taekwondo grandmaster, being in the martial arts, the art of doing things is what we learn through martial art.
I know, and it's interesting, this whole new thing on Facebook Live, we've had so many people tuning into
Get to
you, which is
enjoy.
a great. And now they get to see you. They get to see your shining face.
Right. And they got to see you because they always say,
Yeah,
"Oh,
right.
what is Anita?
Yeah, right,
what does
right, right.
Anita
Yeah,
look like?"
What do I look like? Right.
Yeah.
But it's funny that we do cover many issues with you. I mean, I do have to share this with people. Many times when Dr. Mencia doesn't have a guest, when he walks in, we're not even sure what he's going to talk about, but he has so many patients and so many issues to deal with. It's easy.
Absolutely. And every week, because we see patients 6 days a week, and every week we see something on patient that I say, wow, what a great teaching moment. So I can go back to the radio and then spread the word that, okay, this was done and it was great, and this was done and it's not what you should be doing, so it doesn't happen to you. So
I think that if people, hopefully everyone comes to you, but if they don't, demand that your doctor sit with you and talk to you about what the results are or whatever you have. Don't do this and let some nurse, I don't care how good they are, to talk to you on the telephone. It's about it. There have been people actually that have been told they had cancer and they've been told on the phone. Would you believe that, Dr. Mencia?
I have, yes. I have two ladies, doctors, students, rotating with me right now. And one of my patients, she's a survivor of 9/11. She used to work in the ambulance in New York City, and is a survivor of 9/11. And she's such a trooper, such a fighter. She's been through so much. And so I went and I saw her, and we need to send all this medication to New York so that they give her all her med and everything that she's on. And I told her, do me a favor. Because, these are two young doctors. One is a foreign grad that just came into this country. And I say, could you sit down with the student? I'm going to leave you guys in the room. And I want you to tell them what you've been through and what you and I have been through. Because, with 9/11, all the conditions they have gone through, at the beginning, in many occasions, Ina had to pull me from the room. I say, Judge so-and-so from New York is on the phone. They want to talk to you about one of the cases. And I have several patients, police officer and rescue that have become my patient. They come to me here. And people that didn't live through 9/11 don't know what we as a nation went through. So I have this two young student. I say, sit down with my lady over here, and I want you guys to talk. And she said what transpired, what was 9/11 all about, what she went through going back in there, getting more people, not thinking of herself as a person and protecting herself. I mean, she protects herself, but as much as you can. It's an emergency. You just go and do what you were trained to do.
And so you have to say goodbye now, Dr. Mencia,
Oh
to
my
all the
God.
people. Let's just give you a phone number. Please go see Dr. Mencia at 954-489-1345 or go on their web at agifl.com.
And the Boynton office.
And the Boynton
I have one other
office.
patient.
270-6494. That's 561-270-6494.
I have one other patient that say, Anita didn't give the phone number to the Boynton office.
So say goodbye to all your
Goodbye. Thank you.
Facebook. Thank you, Dr. Mencia.
Thank you, Anita.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.